5 years ago, we really had an opportunity with the NHS 5-year plan to think differently about the future of the NHS.
The Healthy London Partnership was established in 2015 to deliver the aspiration that we collectively had that helps support London become the healthiest global city.
The Healthy London Partnership provides something that we don't have as traditional CCGs.
The value of HLP is the value of its partnership and that collective delivery.
So I think HLP has done a raft of things that have actually made a real difference for the person on the street, the real kind of Londoner.
It's been inspirational to see how London can work as a city to bring together big changes.
To meet the needs of all patients, and hopefully we'll cut out inequalities across London.
So I think it's absolutely clear that there's a need in London for us to have an organisation that really pulls the system together and allows us to do great things together, once and with impact.
So when the partnership started to form after the inception of HLP, it was a hugely exciting period. So we all had this aspiration that we collectively signed up to be the healthiest global city. And that was kind of the North Star that we worked towards over the coming years.
It's been great to be in HLP from the very beginning because I've seen how it has evolved from a predominantly NHS-focused organisation to one now where we have hundreds of partners working together across local government, across the charity sector, bringing in lots of patient and public involvement.
It's grown in terms of size, it's also grown in terms of impact.
It's just seeing like work actually happening when you do something and we actually implement it and actually seeing it. That's the highlight of my work.
I am always blown away when I look at the annual reports of HLP because you get an insight into just the range of activities and projects and collaborations and outcomes that are being achieved through working together at the London level and supporting all of this innovation.
One of the signs of success, if you like, of HLP is the sheer number of programmes, so the trust that we get in developing those partnerships and those areas of work jointly across London.
The work that we've been doing over a number of years for social prescribing has been a fantastic piece of work.
Lobbying the agenda and trying to get that into policy for the last 2-3 years, I think it's really paid off. It's now in the long-term plan.
Social prescribing, for me, it's about identifying non-medical needs which patients have and getting them to that place.
The stuff that Healthy London Partnership done, there's a whole raft of things that it's done really. Supporting London to be the first region to achieve extended access in primary care, for example.
The GP Extended Access Service offers additional bookable appointments for patients registered with a Lewisham GP practice.
We did some really exciting work looking at how we can improve the food offer for young people on high streets.
The HLP project that stands out for me is the development of the Mental Health in Schools toolkit, developing tools that's available on the web for schools, for young people and for health professionals.
We've got the Healthy Schools programme. We've got the Run a Mile a Day programme in a lot of schools.
The Children and Young People's Asthma programme is great. It's had a tangible impact on how children and young people's asthma management and treatment happens in London.
Thrive is a citywide movement of Londoners all working together in a collaborative way to improve the mental health and well-being of all Londoners.
Thrive London is just a brilliant initiative. The impact that we've had has just been incredible.
We've trained literally thousands of people on preventing suicides. We've introduced a national first around collecting data on suspected suicides.
Having a suicide prevention hub where we've got real-time data from all first responders. That is one of the first in the country.
The Good Thinking project is an attempt to leverage the opportunities of digital technologies to reach people with mental health difficulties, to help those who are looking for support find good quality support earlier.
NHS Mail is bringing the care homes into the sort of data exchange and information exchange that everybody else in the NHS has the benefit of.
It's allowed us to transfer information safely, quickly and effectively so that we can ensure that we can meet the residents' needs from day one. I think what I've been most proud of is the Mental Health Crisis Care Programme, bringing together acute trusts, mental health trusts, London's 3 police forces, social care, and huge service user involvement to develop a Section 1 through 6 model of care.
The programme really aims to redesign the way in which people who are mentally unwell when they're in crisis are receiving care. Many of the times people were being taken to police cells when they should have been taken to hospitals because there either wasn't an understanding of the right pathway or there wasn't capacity to accept them.
People are being treated with more dignity and respect in a place of safety than before. I've talked to people who've been through there and they've said how much better it is.
One of my kind of proudest moments at HLP was when the Mayor of London launched the New London Pathway for patients in mental health crisis. To see it come together that day with all partners, that's when you see the real results of what HLP can do and what kind of it has done.
The difference of life expectancy between rich and poor is 11 years. When you travel down the central line from west to east, you almost lose a year of life with every station.
We need to prevent health inequalities and poorer health issues to ensure better outcomes for Londoners.
If you're someone who's slept rough in London, your average age of dying is still in your 40s, some 40 years less than the general population. Within the Healthy London Partnership, we have a London Homeless Health Programme that has explicitly been set up to try and tackle that.
So the Healthy London Partnership, it's done a ton of work with vulnerable groups. For example, on the Fire Safe and Well visits, there's over 1,300 visits have been made. So gone into vulnerable homes and communities and supported those people in those homes with stuff like fire training, smoking cessation, fall prevention.
We know across the city there is huge variation in outcomes. How do we begin to use the resources in areas that need it the most?
To make London the healthiest city in the world, we have to address HIV.
HLP's work in supporting the HIV fast-track cities was able to make significant contributions. This is a fantastic initiative where London as a city is committed to ending the transmission of HIV in the next decade.
The aim of the programme is to get to zero. Zero new infections, zero HIV stigma, zero preventable deaths from HIV.
We've just funded 12 programmes led by voluntary sector organisations which we think are going to improve testing in HIV, improve the quality of life of people with HIV and make sure that those that have been diagnosed aren't lost to services.
That amount of output and that amount of contribution to the complexity of our city is critical because it means that we know we're making a difference.
I think some of the main successes that HLP have had is bringing partners together to achieve the scale of our ambitions in terms of making London the healthiest global city and the best city in the world to receive care. Only by working together can we genuinely do that.
For every change programme that we have in HLP, the impact is about the collective action that London takes.
The Healthy London Partnership provides that organisation that can bring all these resources together.
There is always going to be a need for us as a city to coordinate our efforts better. There's always going to be a need for us to think about how we do things together and do them once so that all of us can benefit.
Everyone within HLP and frankly everyone within the London system is passionate about improving Londoners' health, reducing inequalities and improving health and care. So that aspiration will never end.
The opportunity to grow this even more is there. We just need to make sure that we build on what we've already got.
I think there's a true sense of determination across all the partners that are working together to tackle some of these big issues, which, as I say, nobody can really fix on their own.
For me, there's a gap and Healthy London Partnerships filled it in, and I wouldn't want to be in a world where there isn't Healthy London Partnerships as a CCG to provide that support and resource.
I am really pleased and incredibly proud of the work that HLP has accomplished over the last 5 years, and I really want to ensure that as we move forward that the keys to success are maintained. Working in partnership, ensuring that there's great communication, thinking about people and what our citizens need. HLP has done that brilliantly over the past 5 years, and I really am looking forward to the next iteration, the future of the organisation, to continue to do that, to build upon it, and to achieve even more.